The Affordable Care Act is in the news once again as it is being argued in front of the Supreme Court. The court is not expected to make a final decision on this until spring, maybe even June 2021, which means you have several months of needing health care coverage before a decision is made. Today, we have experts with us to talk about ACA open enrollment, your own work benefits, and Medicare enrollment as well. If you have a question, we want you to text those questions to the number that's on your screen right now. That's 336-379-5775. Remember, this is a text-only question, so do not call that number. Let's introduce our experts. David Sevier is the founder of North Carolina Serious Illness Coalition, and Josh Peck is from Get America Covered. All right, gentlemen, thank you both for joining us. Let's first go over, Josh, the open enrollment times, because open enrollment for the ACA is right now.
That's right. Open enrollment started on November 1st, and it runs through December 15th. It's important that people know that December 15th is your last chance to get 2021 coverage until next year's open enrollment. So it's very, very important that people enroll by December 15th.
Okay, because again, like you said, they will be without coverage then. All right, so David, let's talk about Medicare really quickly, because Medicare enrollment is kind of all the time, except that you have to be very specific in when you enroll in Medicare.
Absolutely, yes. You need to enroll in Medicare before December 7th, and then it's effective as of the first of the year following. So it's very critical that you, not unlike the ACA, that you understand what options you want to receive. There are a number of options, and then how you go about that. So you've got to make sure that you've got your Part A, your Part B, and then you have options about other things.
Okay, but that enrollment is 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. So you have 7 months to enroll right before you turn 65 and when you turn 65. Otherwise, you get some severe penalties.
You do not want to have a situation where you haven't enrolled. It's very painful, and it will continue on for the rest of your life, basically, if you haven't enrolled at the appropriate time. You've got those 7 months essentially, like you said, Tanya, and then if you don't do it, it's pretty dire.
Okay, so this person says, if I don't do anything, will with my Medicare that I now have roll over to the next year automatically? David, is that you?
Yes. If you need to let it roll over, then you can, but you need to make sure that you're covered under some other provision, either your employer or through another provision that you might have.
Okay, and we do have, I believe, a graphic that shows the different parts of Medicare so that we can kind of put those up, because all the parts don't mean the same thing. For instance, Part A covers the inpatient hospital stays, Part B is the premium to pay, covers your doctor visits, and D is covering prescriptions, and then Medigap is a whole different thing, David.
There's Medigap that you can get, which is essentially a supplemental. It pays some of your expenses, or you can enroll with a Medicare Advantage plan, and there are a number of different Medicare Advantage plans. So essentially the byword here is learn about your options and really study it like you would study anything else, and make sure you understand the options that you have.
All right, speaking of options, Josh, someone is texting, once I do open enrollment with ACA, how long does it take for my plan to kick in and offer coverage?
Yeah, it's a great question. If people enroll by December 15th, their coverage will take effect on January 1st of 2021. And then as long as they pay their premiums, they'll keep that coverage through the year.
All right, and this is an interesting question. Maybe both of you kind of chime in on this one. This says, why are premiums so expensive? The only plans I can afford are the high deductible, which is $8,500 out of my pocket before any benefits.
Go ahead, Josh.
Yeah, that's a great question. Health insurance is expensive because healthcare is really expensive in America. But what a lot of people don't realize is that because of financial help that's available, there are very, very affordable plans that are available. For example, in North Carolina, 4 out of 5 healthcare.gov customers in North Carolina can find a plan with a monthly premium of $10 or less. To be clear, this is expensive coverage, but the financial help that's available makes the premium that somebody pays each month just much, much more affordable. Or last year, there were 325,000 uninsured people in North Carolina, which is 40% of the uninsured, who had access to a plan with a $0 monthly premium. And when it comes to things like monthly deductibles, when it comes to things like deductibles or out-of-pocket costs, there's financial help for certain types of plans that make those costs more affordable. So the majority of people in North Carolina saw their deductibles actually go down this year. What I really recommend is that people go to healthcare.gov, enter their household income, and see what's available, because that's the best way that you'll see what options are there to meet your family's needs.
Okay, so this person kind of followed up on a text with when you were talking, and says, how can I find out if I'm eligible to get assistance to buy health insurance?
It's a great question. So there are really 2 ways to do it. Healthcare.gov offers a feature called window shopping. This is meant to be maybe a 2-minute process. It is very, very important that you enter your household income when you go through that window shopping process. That may not seem like important information, but it makes all of the difference, because it helps give you a sense of how much financial help you're eligible for. And a lot of people think that financial help is only for very, very low-income people. But the reality is that financial help is actually targeted at people who are working. So a family of 4 who makes $100,000 a year would actually be eligible for financial help. So what I recommend is that you go through that window shopping process, enter your household income, see what's available, and alternatively, you can also fill out an application that takes probably 10 or 15 minutes, and then you'll get your final sort of eligibility verification for how much financial help you're available for. But the window shopping process is quick, easy, and it's a great way to find out what's out there for you.
And it's all online. And right now, if you go to the Who Wants to Know section, we have an entire web story there so that you're able to click on the ACA and be able to do that kind of window shopping. We're getting a slew of Medicare questions, so what we're going to do is we're going to take a quick break, allow you to text some more questions, and then we'll be back to answer those Medicare questions that we have in text and your questions as well. We'll be right back.